Good that you're here. Welcome, everybody. How are you?
Very good. How are
I'm
you?
fine.
Yeah, fine. The exam went great. In fact, I think was well done so far. So this leaves us that we're going to start the new chapter, a new module, and the new module we will start is module number 3. And the module number 3 includes the digestive system, the respiratory system, and the circulatory.
Mister,
Yes.
sorry, my internet was failing, so I just arrived.
Okay, no problem. So the module three includes digestive, respiratory, circulatory, and urinary system. So it will take a month. The introduction you can look at for yourself because it's in Spanish, and we're not going to see it because it will come anyway in the different weeks. The lab, I put the date in 1 month, and the integrative activity as well, because these are the things of the module. So each week you have to do the review activity, and these things are per module. So you have to do this. You have to have this ready in 1 month. So you have plenty of time to do that. Okay, so we're going to have a look at these four systems. And the first one is the digestive system. Let's start with a small video about it because I know you know already, but I really want you to realize how serious the situation is in Mexico if we talk about the digestive system. It's really, really bad. So let's have a look at why is it so bad and why did it become so bad, you know? So here we go. It's only 2 minutes, even less.
Adult obesity levels are now higher in Mexico than the United States, according to official UN rankings, as the country battles to cope with changing lifestyles and diets. Almost a third of adults are obese as more and more Mexicans take to guzzling fizzy drinks and downing junk food, turning their backs on the country's traditional fare of tortillas, beans and chili.
Esto tiene una causa.
This consumer rights campaigner says the main cause is the deterioration of healthy habits. We have the highest consumption of soft drinks in the world, 163 litres per person per year. Obesity is related to this, but also to the abandonment of the traditional diet and the consumption of junk food.
El abandono de la dieta tradicional y el consumo de comida chatarra.
Weight-related diabetes is Mexico's biggest killer, claiming 6 times as many lives as the country's gang wars. Obesity is now described as an epidemic, particularly hitting poorer communities in tandem with malnutrition.
We've
arrived at a point of no return. We either resolve it or we'll lose the country. We'll see the collapse of the health system. And the health system can't collapse without the country collapsing too. We can now say that it's a national security problem. Mexicans call the problem vitamin T after all the tacos and tostadas that are gobbled up. As more people leave behind the hard physical jobs they once did, they also find healthier food such as fruit and vegetables too expensive, while the waste-expanding alternatives remain all too tempting.
You're muted.
Teacher.
muted.
I don't agree with one thing. They say like healthy options like fruit and vegetables is too expensive in Mexico. That's not true. If you go to the market, you can find perfectly healthy options for little money. The thing is, yeah, you have to cook it yourself. But guys, this is very serious, you know, because I mean, in Mexico, people they really don't realize it. They think that things are normal, una coquita no pasa nada, and seriously, people are getting very, very obese. Just look at the numbers, guys, and things have become worse in the pandemic because people are at home, they work from home, they stop doing sports, they have less money, so they eat even more unhealthy and they do less exercise. Let's have a look at the health profile of Mexico. Here you have Mexico, and let's go down here. Yeah, it tells a little bit about coronavirus as well. Here you see the Mexico total deaths by cause. Okay, coronary heart disease number 1. Okay, This is due to the diet. This is caused because of obesity, okay? Diabetes mellitus, caused by your diet, caused by drinking too much refresco and eating too much sugar and eating an unhealthy diet. Stroke, number three, caused by your diet, okay? It's caused by Mexican diet, strokes, because what happens basically is accumulation of fats in your veins and arteries of your brain. The blood cannot pass anymore. The vein or the artery breaks, and you get a stroke. Liver disease, typically a consequence of unhealthy diet, alcoholism, eating too much fats, too much sugar. Lung disease, well, this is not directly related maybe to our diet, but it's definitely related to possibly certain cities like Monterrey, Mexico City, where the air contamination is really bad. Kidney disease, directly related to the diet. So my point being, guys, if you look to the top 5 causes of death or the top 6 causes of death here, they have all to do with what you eat. And that's really, really sad because, I mean, it's such a lovely country, Mexico, the most variety in fruit, vegetables, food, and people are only grabbing to junk food more and more. And it makes me really sad because, I mean, of course, this year I had a break and I'm really happy for it, but I have some children, you all know that, right? And to give an example, if we were invited before the pandemia to certain piñatas, I could not believe what they were giving the children. It was from the beginning of the party until to the end of the party, complete junk food, chatarra. And to make it all perfect, in the end, you have like the cupcakes with like 5 centimeters of espuma with all kind of colors, red, blue, pink, purple, but like healthy options, impossible. And then my wife and I, we decided whenever we do a piñata, we're gonna give them a nice ponche. We're gonna give them real agua de Jamaica. We're gonna give them real lemonade, like real nice things, fruit cocktail for eating. But there, it's not allowed in our party to have this. This only this bad food and things that make your children ill, because you're teaching your children from really, really young that it's okay to eat this kind of stuff, and it's not one dulce that they eat, I mean, if you have a piñata, the half of the children, they have the next day diarrhea and they have belly ache because of all the mugrero, sorry for my French, that they eat. Okay, and I think you have to take care of yourself, guys, because this is very tricky. This health and this diet is super tricky because the consequences, the damage, once you start noticing it, it's too late. So do yourself a favor and eat healthy, eat fruit, vegetables, do eat as little meat as possible, because that's another problem. I'm not against eating meat. I eat very little meat myself, and I'm not 100% against it. But you don't need to eat as much meat as they eat in this country, guys. If you eat like 1 day meat and 2 days no meat, that's more than enough, and you're doing a big favor to the environment. But it's not a good idea to eat tacos de barbacoa in la mañana, and then at midday, nice arrachera, carne asada, and in the evening, you're gonna eat tacos de chicharrón. Really, you're doing so much harm to yourself. So take that into account. I get very emotional about it because this is a big problem. Okay, and
Yes, sir.
yes.
And how about like fish or like sea animals?
Yeah, fish is definitely the more healthy option than meat. In fact, there's more and more investigation done, and it seems that we're not supposed to eat red meat. Okay, if we go back to, if we look at our digestive system and we look at our teeth and we look how all our enzymes and all our digestive system is built, everything looks like that we are made to eat more vegetables and very, very little meat, maybe some little bit of fish, but we're definitely not supposed to eat cows and big animals that are evolutionarily more related to us. This is not how we are designed. Okay, I'm sharing my screen here, And this is a little bit what Mexico is on one side, you know, refrescos. I mean, sometimes I cannot believe it when it was even before the pandemic that they could mix like gummy bears with papitas, and they put like salsa and then more sugar and then more fat and then like here below these kind of things. I mean, it's one of the most striking things when I arrived in Mexico is seeing what you eat, and it's so striking. I'm not saying that you all eat bad, because honestly, I think you all look lovely and I think you're doing fine. So my message is just to maintain your healthy diet. I don't think that I mean I had a look at the health journal of the core activity. Some of you have to go a little bit down with the eating, but nobody is like mortally obese or something. If I was looking at your BMIs, everybody looks more or less fine. So you're doing fine, okay? But anyway, talk to your family. What you eat is not normal. Seriously. When I came here, it was like I said, one of the most striking things that I saw is how much they eat, and they never stop eating. Just go to the city center, and everybody's eating in the street all the time. They don't even finish the bote met papitas y luego van por un helado, para decirlo un poquito exagerado, ¿no? But that's really bad. And the other thing is that the alternatives are there, you know. You have all this healthy food that is available as well in Mexico. I think you have lovely cuisine. You can make great foods, vegetables, chicken, fish, all these things. They exist, you know. And the balanced diet, it's something you have to choose for consequently. Okay, so what are we going to do in these 2 days? We're going to run over the digestive system, and we start at the mouth and we end in the anus. Okay, because the food comes in out, it goes in the mouth and it comes out of the anus. And we have a look a little bit why that's happening and how that's happening. Okay, so this is a little bit how it starts. You know, the mouth with the salivary glands, and it ends in the rectum. So this is a little bit a summary of how the food passes through everything, and we're going to see that step by step, okay? So remember the abdominal cavity, okay? Because this is the biggest cavity we have in our body, and it is the cavity where most of the action is happening, okay? The only thing that is not happening in the abdominal cavity is our chewing and the tube that connects the mouth to the stomach, which we call, somebody knows?
Esophagus.
Esophagus, exactly. And this abdominal cavity, like any cavity, just like bones and any organ, it has membranes around it, okay? And those membranes, we call that peritoneum, okay? Peritoneum, you see that here, you have different ones. You have the visceral peritoneum, which is covering certain organs, and the parietal peritoneum, which is basically covering the walls of the abdominal cavity. Okay, so we have two membranes, one around the organs and one around the cavity. Why is that, guys? You know why we have those membranes? No? We want to separate our organs a little bit from each other, okay? The membrane, for instance, if you have a liver infection or you have like a gut infection, it's those membranes that do not allow the bacteria to pass. So basically, it's like a security wall. So if there is some infection in one side, that the infection is contained, and also that the membranes help protecting the organs and the cavities. So it's just for our safety, because if we would not have them and think about a certain infection, then it would way more easily spread all over the body. So those membranes, they really do a good job and they cover really well. You can see that here in the pictures as well. You see here the membrane, and this is when the surgeon opens the membrane to look at the intestines. Guys, I want to warn you a little bit for my presentation content. I don't show you these things to shock you, okay? It's just things that I believe that at your age you have to be confronted with, and you can have a look at it. And I do this because some of you will become doctors, maybe surgeons, And I don't think it's bad to see real life pictures of the human body, of organs, of the inside, of illnesses. And sometimes they look a little bit shocking or a little bit ugly. So if you have problems with this, then just don't look at it, okay? I have no intention to shock anybody. I have no intention to offend anybody. I just put them there because I feel that the course is more complete and that little by little you can come in contact with these kind of things, okay? Because maybe some of you will become doctors. No, I'm not maybe, I'm sure that some of you will become doctors or they will go into the medical world. And you have to start learning to see these things to know for yourself if this is something you can deal with or if this is something you want to look at in your professional life. And if you're really, really shocked right now and you say, no, it's really nothing for me, then you already have an answer, you know? It helps you a little bit deciding which direction you want to go with your life, okay? So if you have a problem with it, please talk to me. Don't be shocked. Don't be offended. It's really, really not objective, you know? I have no intention of doing that, just that you know. And of course these pictures are not so shocking or so confronting yet, but there will be other ones that possibly they're a little bit higher on the scale of confrontingness, let's say. Okay, so let's continue. So our digestive system, we can say that it starts in the mouth, okay? We have the mouth, we have the pharynx and the esophagus, okay? That's the first pathway that we have. And our mouth is already doing a first very important job and is doing two jobs, in fact. It has one part which we call mechanical digestion. What would we mean with mechanical digestion?
Like
Chewing.
Yeah, perfect. Chewing, indeed, because you chew your food and you mix it with saliva. And this saliva has an enzyme in it, which we call amylase. And amylase is already an enzyme that breaks down starch into sugar, into glucose, let's say. And you know that, I don't know if you ever ate those grape sugar, you know, these little rolls with little dulces, let's say, like little sweet things. You put them in your mouth and you chew on it and all of a sudden they disappear. Do you know those? They give them in the piñatas, and in fact it's not that bad because this is just fructose, you know. Do you know those? And it disappears because of the amylase in your saliva. It already digests it and it just disappears. It's the same with Gatorade. If you drink Gatorade, you think like, it's really watery in my mouth. It's because it has certain sugars in it that are immediately broken down in your mouth and absorbed in your stomach very quickly. And that's why these are energy drinks. Because they give like instant energy. Of course, if you drink high quantities of this, it's not good for your teeth and it's also not that healthy. I mean, if you really do sports, we can keep it in between. But Gatorade is not that great, you know. If you do sports, then you have to think more about minerals. So then you have to think more about electrolyte and Swerox, this kind of things. They're in fact better than this Gatorade stuff. And I don't know what else, Aquarius and this kind of supposedly sport drinks, because they're really not that sporty, you know. I mean, if you really want to sport a long time, you have to think about the amount of minerals you take in order not to dehydrate. So whenever the saliva mix with food, we call that bolus, okay? You know what bolus is. If you have babies, sometimes what comes out the mouth, this is bolus, okay? And then when you swallow, the food goes through the pharynx. So the pharynx is in fact the place between the mouth and the esophagus. So it's basically right here. This is the pharynx, okay? Just next to the larynx. Not to get confused, the larynx is part of the respiratory system. That's this here. That's the wind tube, the trachea and the wind tube, okay? The pharynx is right here, okay? Because that's part of the digestive system, and this goes into the esophagus, which is behind the trachea. So if I look at myself, if you look this here is not my esophagus. This is my wind tube, my trachea. My esophagus is behind that. In fact, I cannot feel it. but sometimes you feel it right here when you swallow something big, that you feel like a little ball right here because it's pushing on your wind tube or trachea, but your esophagus is a little bit behind. If you don't believe me, check out the Bio Digital Human, and you can nicely see that right there, just as you can see it on this picture. Now, guys, if you swallow, the food goes into the esophagus, and the esophagus, it's not doing anything. In fact, the only thing the esophagus does, it has like peristalsis. It's like smooth muscle that squeezes, okay? It's squeezing the food down until the stomach. But why do you think the human body would make a tube from here until here, about 30, 40 centimeters long, that is just squeezing the food down and is not doing anything else? Why is that?
So it can break down?
No, it's not breaking down. It's not doing anything. It's just a tube connecting your mouth with your stomach. There's nothing absorbed. It's not digesting anything.
Because it may be dangerous to have like acid in your throat, like digestic acid that's found in the stomach.
Yeah, you're
Because
getting
we
there.
have like the heart and like the things up here, and then well down we have our digestive system.
That's it, Leonela, perfect. Why do we have an esophagus that is really, really thick? Because it has to pass our most vital organs. So basically, evolution did a great job because they said like, okay, here we're not gonna do anything, because if something goes wrong, then immediately the lungs and the heart will be affected. So let's just make it a transport way. Food swallowed goes down to the stomach, and that's where we start. Because if, like Santiago says, and like you say, Leonela, if you get problems at that level, then very easily lung and heart could be affected. And of course, that can never meet the meaning, because those are our vital organs, and we don't want problems there. And you know what I told you in the past, if we talk about the digestive system, it's our system of all the systems we have that basically gets the most ill in our lifetime. Okay, so the digestive system is the system with the most disease in your lifetime. Okay, think about yeah, it's between, I think, digestive system and respiratory, but the digestive is still winning. But think about the amount of times you had belly cramps, you had diarrhea, you had stomach problems, all of this, even in is maybe not that much for us, even if it's a lot for us. But if you think about more developing countries like Africa, always the problems, they occur in the digestive system, and it's the system that is the most affected. And I think in second place, it's most likely the respiratory system that is most affected, especially with the contamination we see now. Okay, so that's indeed the reason. Guys, there is one thing here that you have to know. We will see that as well in the respiratory system. So whenever you swallow, we have like a little valve which we call epiglottis, and this is a valve when you swallow. You know, that's basically the epiglottis closing. And the epiglottis is closing the trachea because you don't want the food to go in the trachea. And it has all happened to us, I think, that the food goes, se me fue por el otro lado, dice, no? And then you immediately react with intensive coughing to get the food out of the trachea, because that's in fact a little bit dangerous. And I think evolution should fix that. Because it's a little bit dangerous, right? If it goes in the trachea, and especially young children and old people, they have to be careful with their swallowing. They have to eat more calmly, because the food can go into the trachea, and that's dangerous. Because if something gets stuck in your trachea, like a fish spine or a nut or whatever, it's sometimes hard to get out, and it would not be the first person that died because of this. Okay. Okay, we also have our tongue. What is the function of our tongue, guys?
Push the food.
Yeah, pushing the food. It helps mixing the food, but it has a more important function than that.
Taste.
Yeah, taste. Of course, taste. Taste is very important because it's the tongue. In fact, I mean, it's not designed that we enjoy our food. Not really. The tongue is designed because when something tastes acid or bitter or really really bad, it's our first protection mechanism to say like, okay, if it tastes really bad, if you ever ate for example spoiled food or something, it tastes really bad, and that's in fact to protect us because then you can spit it out and you avoid your digestive system becoming infected with certain bacteria. So in fact, our tongue, our taste in the first place is not to enjoy our food. Nowadays it is, but in fact on evolutionarily and on a human scale, to say it like that, the taste is just to protect us from things that are not good for us, you know, because like toxic things, unhealthy things, spoiled things, all of that tastes really bad, and our body recognizes it. So if you eat something that really really tastes bad, you have to ask yourself, it probably tastes bad for a reason, because it's not good for you. Okay. So in our mouth, guys, there's already certain problems that can happen, and you can already see here like mouth cancer. Okay, mouth cancer is very very serious because it's in your head. It can spread out very easily. And how do you get it? Well, many reasons. Lots of alcohol, smoking, drugs, chemical, lots of colorants. You can have tumors. The prognosis is poor, guys. Prognosis means what is the possibility that you will get better of it. You know, prognosis is in fact like what will we expect of you when you have this disease. When prognosis is poor, it means that it's unlikely you're going to get better. So if prognosis is poor, then you have to start thinking that probably this illness will die. It will kill you. Okay. Pharyngitis as well. It can be viral or bacterial. We all had pharyngitis. If your tonsils are swollen and you have pus in your throat, I don't think that there's anybody of us who had not had this, or nobody had pharyngitis yet.
Pus in your throat? Damn.
Like you see in the picture here, the white stuff on your tonsils, it's bacterial, could be viral as well. Prognosis is really bad, really good. Usually you get better because of this. Certain people have their tonsils removed, but basically it's something very recurrent and we can get better of it. And it's because we have a lot of white blood cells here, because the tonsils, they are like a kind of glands here in the throat as well for white blood cell production and storage, so that they can easily fight off diseases whenever they happen here. That's why it swells. Okay. And then esophagus cancer or throat cancer, guys, same reasons. Don't smoke, don't drink too much alcohol, because especially liquors, if you drink a lot of tequila, a lot of mezcal, a lot of whiskey, the burning of the alcohol can damage the DNA of your cells. If you do it now and then, it's okay. The cells, they can regenerate. A little bit of alcohol doesn't harm it that much. But if you're an alcoholic and you do this on a very recurrent basis, and you do it that much that your body cannot fix the problems anymore, then it can convert into cancer, and prognosis is poor again. Anything of the digestive system, any cancer of the digestive system, guys, it's very poor prognosis. Okay. Because it's a very long tube, and whenever you have cancer or a tumor somewhere, it can spread very easily to other parts. It goes to the liver, it goes into the bloodstream, it goes everywhere. So you have to take care of what you eat and of your digestive system, because it's not only the one that gets ill really really fast, it's also the one that gets very easily if there is a cancer there, that it looks very bleak, the outcome of this. Okay, before we continue to the stomach, and we still have to talk about the teeth as well. I think stomach will be for tomorrow. We also have salivary glands. Okay, salivary glands, we have several of them. We have the parotid gland, we have the submandibular gland, and the sublingual gland. They all produce saliva with the enzymes amylase inside of it to start digestion. It's made out of 98% of water, and 2% is amylase and other enzymes. And did you know that in fact you're producing between 0.5 liter and almost 1.5 liter of saliva a day? Okay, where does that saliva goes, guys? Do you know?
To our digestive system.
You swallow it. Most of it you swallow
Yeah.
it. So the saliva is produced constantly. When you eat, you produce even more. If you do certain drugs, you can get very dry mouth because it stops the production of saliva, and it really feels bad. So saliva is important, and basically your mouth on the inside always has to be wet. If your saliva production stops, the environment for your mouth is not very good, and you will start feeling bad. So saliva is very important because it helps digestion. It mixes with the food, and then it can be pushed on to the stomach. These saliva glands, they can also be infected, and one of the most important things, or the most common one, is what we call mumps. And in Spanish, you call that paperas. Okay, have you heard of paperas? In English, it's called mumps. It's a viral infection. Normally, you get a vaccine when you're a child against this. Okay, and this illness, I had it. In fact, I remember when I was a child, I got mumps. It goes away, not a big problem. In fact, it's painful. It swells a little bit. It takes about 1 to 2 weeks, and usually, if you're a strong child, you fully recover. It's not really a big problem. But we vaccinate against it because in certain cases it can become severe. It causes headache, muscle aches, some tiredness. You don't feel like eating anymore, and it's basically because your salivary glands are infected. Okay. When we go to the teeth, guys, we have about 32 teeth. Okay, you have to know the names. We call the middle ones the central incisors. Then the two next to them are the lateral incisors. Then the vampire teeth, you know, these ones, the vampire teeth, we call them cuspid or canines. Okay, and then after the cuspid teeth, so the cuspid is in the girl, I think it's a girl. This would be the cuspid. Okay, here, this one. Which is the vampire teeth, and then we have the first molar, second molar, and third molar. So it's really not that hard to name your teeth. So next time you go to the dentist, you can tell them, it's my second molar that is hurting, or it's my cuspid teeth that is, or my canine teeth that is a little bit painful. So I said, really nice. You paid well attention in your biology lessons. So you have to know these teeth. You have to name your teeth. It's very easy because, I mean, it's the same name on each half side. So it's very easy. Teeth are made of enamel. Okay. It's the hardest substance our body produces. Okay. If you eat a lot of sugar, this enamel gets destroyed. And if sugar, why do you get caries? Because bacteria, they convert the sugar into acid. The acid makes a hole in your enamel, and it goes down to the dentine. Okay, and the dentine is basically the bone of your teeth, and inside the dentine you have like the nerves and the blood veins, because your teeth are alive. It's not a piece of bone without any function or without life. Teeth are alive, and if they die off, they will fall out eventually. That's why I never recommend anybody to do teeth bleaching, because what you do with teeth bleaching is you're going to put chemicals that pass through the animal, and then they are going to change the composition of dentine because of the how you call that, the oxygen, what it's peroxido, you know, and this is changing dentine to become more white. And the problem is that if you do teeth whitening, then afterwards they become even more yellow because your teeth are alive and your dentine will regenerate. And it's really nice for you if you have nice white teeth, but it's a genetic thing. If your teeth are a little bit yellowish, that's perfectly normal, because it means that your dentine is of a different material. It's like skin color. It doesn't mean that if your teeth are slightly yellow, that you're unhygienic or something. And they often think the darker you are, the whiter the teeth are, but it's just because of this contrast with the skin color, you know? It's not always like that. Okay, so here you see caries. I just told you, you get this because of bad tooth hygiene. Okay, if you eat too much sugar, if you drink a lot of Coca-Cola, it's really bad for you. You can treat it really well, but it's never very healthy. Did you know that, by the way, scientists, they made an important link between poor tooth hygiene and heart problems? Because if you have carriers, it's in fact a nest full of bacteria, and those bacteria, they go into your bloodstream and they do harm to your heart. And how do they do harm to your heart? Because those bacteria, they flow in the bloodstream, and in fact you get an inflammation process everywhere, like a very small inflammation all over your body, and this causes problems on in the long term. If you don't believe me, Google it and check out what they discovered, that bad teeth causes heart problems. Okay, and then this, you don't have to know it, but you know that little children, they have less teeth. Maybe remember that they have 20 teeth. Why? Because they don't have they have only like a first and a second molar. They don't have like the third molar, so they have less teeth than adults. Okay, why do they have less teeth, guys? And why do our teeth change when you're 6, 7 years old? Why do you call the milk teeth? They fall out, and then you get new adult teeth, like real teeth.
Is it because of the food we eat? Like when we're younger, we eat like papilla and milk and stuff, and
No,
we're older. No?
no, it's not the reason.
Is it so it can fit in the bone?
Yeah, perfectly, Rafael. That's the reason. Children grow, their head is small, they don't have place for adult teeth. I mean, they would look really weird if you have a child, a little baby with adult, I know babies don't have teeth, but like a young child with teeth, the teeth just don't fit. So basically, that's why you first have like milk teeth, and then when the head grows to more normal size, to adult size, they get replaced. And you see that when you have children of 6, 7 years old, and you see that their teeth are replaced, sometimes they look a little bit funny because it looks like a lot of teeth in such a small child. And that's because the teeth are still a little bit too big for the head, you know. And then when they're a child, they might look a little bit funny, but as they become older, the head grows, and then the proportions become better. So basically, we change our teeth because of growing, okay? Because otherwise, yeah, they don't fit. So this esophagus is about 25, 30 centimeters long, depends on the person, sometimes a little bit longer. The only thing it does is peristalsis, okay? Peristalsis is smooth muscle pushing the food to the stomach, okay? And you know, I already told you why it only does that. And then maybe we can have a quick look at stomach, because otherwise it will be a lot for tomorrow. Our stomach is basically where real digestion begins. The stomach is basically a bag where all food is collected, and it does several things. It produces an acid, you know that, because I think we all have vomited in our life because we were ill. No, you never vomited. I think we all did. And
No, of course, yeah.
yeah, you all know how unpleasant vomit is. You know, it can really burn. It's really dirty. It's uncomfortable. It's acid. It really makes you feel bad, and that's because the vomit is basically coming food from the stomach that is already mixed with hydrochloric acid. And this hydrochloric acid is produced by the stomach to break down the molecules in smaller pieces. So in case you're ill and you vomit for some kind of reason, you vomit out this acid as well. And as we will have a look further, if you're ill and you have, for instance, a condition called bulimia, which is caused that you vomit because you feel too big or something. It's like a psychological condition that certain people, they vomit after eating because they don't want to gain weight. And you see that if you vomit a lot, then your teeth will be affected because the acid of the stomach breaks down your teeth. Okay. And our stomach also produces an enzyme which we call pepsin. And pepsin, it's an enzyme that breaks down proteins. Okay, protein, peptin. Okay, so it's very important because in our stomach, in fact, the digestion of meat is very important because proteins are broken down to amino acids. Okay, and then our stomach is very interesting because how do you think like it's so acid, the acid of the stomach? It's in fact one of the, if you would put, did you know, by the way, if I would put like a little cup of pure stomach acid and I would put my finger in it for several minutes, that my skin would start to fall off. It's really, really super acid. And then you can wonder yourself, how is it possible that we have like a bag in our body which is full of acid that it's not digesting itself? Well, that's because we have mucus. And our stomach, on the inside, we have specialized cells which produce mucus, and this is in fact a very basic substance. It's always a war. The acid is trying to destroy the mucus, but the stomach is all the time growing mucus, so it stays into balance. And that's why our stomach can handle this level of acid. But from the moment you have more acid production than mucus production, this can happen if you eat a lot of meat, if you eat a lot of fats, then sometimes our stomach will produce more acid, but too much acid. So sometimes too much acid, and the stomach cannot produce the same amount of mucus, and then you will start to feel this burning feeling in your stomach. And that's really bad because it means that the acid is attacking your own stomach, okay? And this also happens in certain illnesses. If you have this burning feeling, you always have to think about what you have been eating. And very, very often it's 3 reasons. Or you have been eating too much oil and fat. 2, you have been eating too much meat. 3, you have been drinking too much alcohol. Those 3 things could immediately cause that you produce too much acid and can cause this typical acid burning. And if you have this, the best thing to do yourself a favor is stop eating whatever you eat and maybe try to get something that is really basic, you know, a base substance. That's they sell it everywhere in Mexico. The most common thing to get rid of this burning feeling that neutralizes the acid of your stomach is, it's this pink stuff.
Pepto-Bismol.
Pepto-Bismol.
Yeah, exactly. So Pepto-Bismol is good for that because what it basically does is neutralizing the hydrochloric acid of your stomach. And guys, it's symptomatic, okay? If you have a burning feeling, I think it's a good idea to take Pepto-Bismol because in that sense, you eliminate the acid and it stops a little bit the burning feeling, but it's not treating the cause. You have to ask yourself, why do I have this acid? And that has to do with probably what you eat. So it's not a good idea because I know people that walk all their life with Pepto-Bismol, and whenever they feel something, no, I'm going to drink a little bit of Pepto-Bismol and I fix the problem. But that's not a problem. You have to take the real problem away, and that's changing your diet, okay? Also smoking, guys. I don't know if some of you smoke, but also smoking affects acid production in the stomach and can cause problems, okay? And
Sir,
if
I
you
have a
don't...
question.
Yes, dear?
Sorry. I want to know if the acidic juices are also related to gastritis.
Which kind of juices?
The acid in the stomach, is it related to gastritis or no?
Related to what? Sorry?
Gastritis.
Yeah, of course. Yeah, definitely. If you have, for instance, bacterial infection of the stomach, they discovered only in 1989 that our stomach can harbor bacteria, which is called bacteria Helicobacter pylori, and also bacterial or viral infections of the stomach can cause changes in acid or mucus production. Okay, so the cause is not only what I said, food and smoking and fats and alcohol. It can also be caused by bacteria. Yeah, you're definitely right. Yeah, but we would come there at a later point. And it's dangerous because if you don't deal with it, you can get an ulcer. And an ulcer is basically when there is so much acid production that the acid is is destroying the tissue of the stomach itself. And if it's really, really bad, it can even perforate your stomach. And that's very, very critical. You have to go to the hospital. You can even die of this. And my dad, he had an ulcer once in his life. They also believe it can be caused because of stress. In the case of my father, it might have been the amount of alcohol he consumed when he was younger, and what he ate as well, maybe a combination of everything. And he told me it's one of the most painful things that you can have. It's a stomach ulcer. I've never had it, unfortunately, but you really, really don't want this. So this is a little bit where we're going to finish today, because I see it's time. And then tomorrow we continue with other details of the stomach and the other organs. We have to do a lot of things because now we're a little bit behind, so we have to speed up a little bit. But anyway, we'll manage, and we see each other tomorrow. Okay?
Bye, Mr.
You're welcome. Take care and have a nice day.
Thank you.
sir.
Thank you.
Wait.